Today's webinar, Competencies and Focus Assessment. I had to get things off with Shake It Off by Taylor Swift, just as a little nod to her recent engagement. But also, I think it's a timely reminder of the challenges we've all been facing in prevention and public health work. Our work has been pretty hard lately, but I think it's also highlighted our resilience. Just by simply showing up today, you've demonstrated your commitment to pushing this work forward. So let this just be a little reminder to shake off the setbacks, to stay focused, and keep moving forward with purpose. My name is Abby Nellis, and I'm a senior associate with CADCA's Public Health Programs team. CADCA, in partnership with the Center for Public Health Systems Science at Washington University in St. Louis, is excited to present today's webinar, which is the 5th webinar in our 18-part webinar series on CADCA's coalition competencies. Now I'm going to go ahead. Before we dive in, I just want to do a quick overview of CADCA. Using a community-led approach, CADCA is dedicated to empowering coalitions and health departments across the globe with the tools, expertise, and support needed to drive positive change in their communities. Through top-tier training services and an evidence-informed technical assistance system, we help build your capacity to implement best practices that improve community health outcomes. To explore more about our work and subscribe to our weekly newsletter, visit cadca.org. While I'm sure everyone is familiar with Zoom by now, I'd like to go over a few housekeeping notes. All participants are muted by default, so for general comments, please use the chat box. We will have a Q&A portion at the end of the presentation. So for any specific questions for the presenters, please use the Q&A box. You will receive a post-webinar email with the recording of the webinar, slides and an evaluation survey. We kindly ask you to fill out the survey. Letters of attendance are given only upon completion of the evaluation survey. And now I'd like to introduce our presenters. Today's webinar will be led by our valued partner, Katie Wieneman from the Center for Public Health Systems Science at Washington University in St. Louis. Katie is a senior research assistant at CPHSS and contributes to several dissemination and implementation science projects. Before joining CPHSS in 2023, she earned her Master of Social Work degree from Washington University in St. Louis. Marsha Bach is a programs manager for the Northern Kentucky Health Department. She has been at the health department for 23 years and manages the programs of physical activity and nutrition, coordinated school health, oral health, and tobacco prevention and cessation. She has designed, implemented, and evaluated health promotion interventions in schools, work sites, and the community. Marsha is involved in many coalitions in Northern Kentucky to advocate for and implement policy change and built environment efforts that promote health. She has led community projects to develop walkable communities, safe routes to school initiatives, adoption of complete street policies, and to advocate for smoke-free air policies in the Northern Kentucky region. She graduated from Morehead State University with a Bachelor's of Arts in Health Promotion and Education. Rick Skinner has been a lifetime resident of Kentucky. Rick grew up and currently lives in Grant County, Kentucky. Rick is a business owner and the former mayor of Williamstown, Kentucky. Rick is very involved in the community as a member of his many clubs and organizations and his volunteerism with Grant County. Rick strives to improve every aspect of the city of Williamstown, including facilities, environment, transportation, public spaces, economic development, historic preservation, health, and quality of life for all residents, employees, and visitors. He focuses on ways of providing more active living opportunities to families of the community, such as more sidewalks providing connectivity, expansion of current park amenities, and the planning for future parks. Rick demonstrates the value of health not only as a personal professional, but also in his personal life. We are also joined by CADCA trainer Christina Clark. Christina is a nationally recognized expert in coalition building, nonprofit sustainability, and substance use prevention with a bachelor's in science from Middle Tennessee University in psychology and mental health services. Her career spans over 18 years of leadership in public health, prevention, and nonprofit management. She is a trusted national trainer for CADCA, where she has guided hundreds of coalitions through the National Coalition Academy, and supported coalitions through training and development for the last 9 years. Her work equips communities with tools to prevent substance misuse and address public health challenges effectively. Thank you for joining us today, everyone. I'm going to go ahead and pass it on to Katie.
All right, so our goals for today are to briefly go over CADCA's coalition competencies. Then we'll focus in on the assessment competency. You'll hear from Marsha and Rick about their example of assessment from Williamstown, Kentucky. And then we'll finish out with learning about assessment support at CADCA and the Q&A. All right, so CADCA's coalition competencies are based on research and expertise from CADCA and coalition leaders from around the world. The coalition competencies are designed to help coalitions be successful and make an impact on their community. This webinar series, Competencies in Focus, is going through one competency at a time. As Abby mentioned, this is our fifth. We've previously done ones on sustainability, evaluation, internal communications, and policy. And today we will be focusing on assessment. So this is the competency page for assessment. You'll see the definition at the top, along with evidence, and then the knowledge, skills, and abilities that are all essential to having a successful assessment process. This competency will be shared with you after the webinar, but we'll also be walking through each of these components next. So to start off with, what is an assessment? We define an assessment as collecting data to define programs, resources, and readiness within a geographic area to identify needs and gaps in substance use prevention. And why is assessment important? While assessment can help prepare your coalition to respond to funding opportunities and use your resources effectively, assessment is also a great way to identify and prioritize needs and guide your implementation. The assessment process is also a way to engage decision makers and community partners, and it can help you improve your coalition's capacity and sustainability. And next, we'll walk through the knowledge, skills, and abilities that are all part of assessment. So starting with the knowledge or things that you need to know, the first one is actually about your coalition. What are the goals and objectives of your coalition? There's the evidence-informed approaches, risk and protective factors, or conditions and strategies that prevent or delay substance use. There's also knowledge of research methods and statistical methods. The skills that are part of the assessment competency include planning, data collection, data analysis, dissemination or communicating your results, and group decision making. And the abilities that are part of assessment include engagement or working with your local partners throughout assessment, timing so that you can integrate your assessment results into your coalition's development and then continue doing periodic assessments, prioritization so that you can incorporate the results into your coalition's action plan, and then activity selection. So you can use the assessment to identify community concerns and challenges and then use activities that can help you implement and solve some of those concerns and challenges. So next, we'd like to provide a brief introduction or assessment 101, just going over some of the goals that you can achieve throughout your assessment process, as well as important steps to consider when planning for your assessment. So assessments are great ways to help you answer questions that you might have about the issue and your community. So during the assessment process, you might ask questions about the issue. These might be things like, where is it occurring? When is it occurring? Who does this issue impact? What are those impacts? And how widespread is the impact? You might also have an opportunity to learn more about your community through the assessment process. And you can answer questions like, what resources are available? What are the community's strengths? Are people ready for change? And what is the community's history and experiences with the issue so far? You'll probably collect two different types of data during your community assessment. The first is quantitative data, which is based on numbers and statistics. You might collect this information through surveys, coalition records, or publicly available data. There's also qualitative data, which is based on words and descriptions. This is often collected through interviews, focus groups, or observations of what's going on in your community. Using both types of data can help you see a full picture of your community and the topic. They complement each other and provide more context and information. So for example, you might collect quantitative data about the number of youth who are vaping in your community, and then you might do interviews and focus groups with youth to understand how they're accessing vapes or why they are vaping. And that can help you better understand the issue and the community by pairing both types of data together. So when planning your assessment, the first thing that you'll want to consider are your objectives and goals for the assessment. This will help you create a clear strategy moving forward and help frame your next steps. So we recommend using the SMART format for your objectives and goals. This stands for specific, measurable, attainable, relevant, and time-based. So this example here shows an example of a SMART goal that includes each of these components. This example reads, our coalition will host 3 focus groups with parents, teachers, and students to learn about youth vaping by the end of 2025. This is a specific goal. It talks specifically about a type of method, the focus groups that they want to conduct, as well as who they're involving. It's measurable. They want to do 3 focus groups. It's attainable for this example coalition's capacity. It's also relevant to their work, and there is a clear timeline by the end of 2025. Another part of your assessment plan will be roles. So considering who will be on the leadership team for your assessment, and then who will be in charge of other pieces like data collection and data analysis. There's also resources, considering what you currently have to conduct the assessment and what you still need, and then making a plan to get those resources. You'll want to choose methods that can help you achieve your goals and answer your assessment questions. Some common methods include interviews, focus groups, surveys, and we also provided a few other examples of methods, such as an asset inventory. An asset inventory is a way to help you identify community strengths. So you can involve different people in your community to get a wide variety of perspectives on the strengths that they see. The community map is a great way to visually see the strengths and needs of your community. You can use a picture or a drawing of your coalition's geographic area and then highlight different places that are strengths and needs. For example, you might highlight a local hospital or a grocery store. And then there's Photo Voice, which uses photos and videos to learn more about the community. This is also a great way to include community members in your work. They can take and submit photos showing you a visual representation of how they see the community and the topic in their lives. So after your assessment is done, a lot of people will want to know about your results. And so it's important to plan for communication from the beginning. So you'll think about how you want to communicate and share your assessment with people like the partners who helped you with the assessment, the general public, and other coalition members. An assessment is an ongoing process. By doing regular assessments, you can better track changes over time and see how the issue is changing in your community. So plan for when you'll do your next assessment and how you can keep the work ongoing in the meantime. And at each step in the process, from planning to communication, there's lots of ways that you can include community members. And so with that, I'll turn it over to Marsha to hear from her coalition.
All right. Well, thank you. We're going to leave our camera off because we don't want to freeze. So Katie, will you be just clicking to the next slide then? Awesome. So our project in Williamstown started with our group, our coalition, Fitness for Life around Grant County. And so as an overview, just quickly about FLAG, we started in 2002 when Williamstown Head Start employees actually noticed rising trends of obesity among our young students there. And so literally the story goes that a teacher noticed that the students weren't able to fit into their big wheels, like their toys. And so this became a real eye opener. And so they brought together people from the community to address this issue, which then helped to form FLAG, which includes folks from the healthcare professionals, our business, our city, municipalities, residents. And so this is how FLAG actually became a coalition. And so, we looked at what our Head Start folks were saying, and then we looked at the data. And so according to the Robert Wood Johnson County Health Rankings in 2023, Grant County scored worse in most health outcomes than the state in several of our categories. For example, 24% of our adults smoke, and 38% are considered obese and lack physical activity. And so this is exactly why FLAG became a coalition, came into existence. And we want to make Grant County the healthiest place to live, work, play, and pray. So as you can see, our mission is to educate and bring awareness to Grant County residents about physical fitness and healthy lifestyles. And our coalition, again, is made up of these residents, youth, healthcare, social agencies, business, elected officials, and our school. And we're proud to say to date, FLAG, being a 501c3 coalition, has secured over $2.3 million for initiatives in Grant counties. So next slide, please. So our focus is on achieving sustainable health goals through policy and system and environmental changes related to physical activity, healthy eating, and smoke-free environments. So why is this important to FLAG? Well, healthy lifestyles and increasing the well-being of our community are just part of our mission statement. Smoke-free environments encourage healthy living and allow residents of Williamstown to set the standard for health initiatives. And that's exactly what Williamstown did. The next slide. So we've been in existence for 23 years and have been instrumental in promoting a culture of healthy lifestyles. And that's really how FLAG started, was changing the culture. So just a quick overview of some of the accomplishments that we've had. We've established orchards within a park. We've done community gardens with some of our low-income communities and at our schools. We've put on programs and events to get people more physically active, such as our 5K. We've had Derby Dash 5K for 20 years now. We've done Walktober. We've had a Biggest Winter Challenge. We've also done improvements to the environment that promotes physical activity, such as enhancing playgrounds, walking paths at school, nature trails, sidewalks, splash pads, outdoor fitness stations. We did things within the school, such as standing desk and activity workstations. So those are some of the things that we as FLAG have accomplished. But so these are things we are proud of, but the other thing we're really proud of is this citizen science project. Next slide, please. So FLAG has been instrumental in policy change and using tools that we have gained actually from the citizen science project. So a citizen science tobacco air sampling project in Kentucky just empowers and trains residents to collect air quality data, which then is used to advocate for local smoke-free policies. And so these projects are particularly important in Kentucky due to the state's high rates of tobacco use and exposure to secondhand smoke. And one of the examples that we're proud of this approach was the project that we were involved in 2018. FLAG collaborated with the Northern Kentucky Health Department and with other coalitions such as the Grant County Champions. And we also used the Universities of Kentucky's Breathe program that provided leadership and guidance on this project. So we're very thankful to the University of Kentucky and their program, because the Breathe program works with citizen scientists to address multiple environmental exposures, including secondhand smoke and radon. So this type of research aims to use citizen-generated data to develop and test new strategies for improving respiratory health and our environmental policy within Kentucky and with our local jurisdictions. Next slide. So our citizen science project aims to reduce the youth substance use, exposure to secondhand smoke, and promote healthy lifestyles. And it all started with assessment to help us prioritize these needs. Next slide. So in order for FLAG to address the needs of Grant County, we conduct a health and wellness assessment about every 5 years. We conducted the survey with a focus on general health, healthy eating, tobacco and drug use, physical activity, stress management, and the environment in which we live. There were a total of 425 respondents from Grant County residents that actually took the survey, and we were able to analyze. And so some of the results were, it seemed that people rate Grant County as a healthy place to live. They feel like in general their health is good. They report good on a healthy diet. However, that being said, people also reported that they're eating less than 5 servings of fruits and vegetables every day. So that we need to take into consideration. Survey results showed that around 96% of Grant County residents believe it is important for workers to breathe smoke-free air at their workplace, and that is important for the public to breathe smoke-free air inside. So these were really great things that we observed from the survey. We also found that Grant Countyans are somewhat physically active. They feel like our recreation facilities are available and that it's safe to walk or jog in the neighborhood. But they did not think it was easy to walk or bike to places of destination, such as churches, libraries, supermarkets, and things like that. And 40% only think that the sidewalks and shoulders are good. So we are able to really gain a lot of information from these health and wellness assessments. We also looked at existing data. So data obtained from the CDC and our county health rankings indicated that Kentucky is second in the nation for smoking rates and first in cancer deaths. Grant County has the highest percentage of smokers in northern Kentucky compared to our surrounding counties. And Kentucky is second in the nation for smoking rates and first in cancer deaths. We know teens who smoke are more likely to use other drugs such as alcohol, marijuana, and cocaine. Secondhand smoke exposure causes heart disease and lung cancer and puts workers, young or old, at significant risk for stroke, asthma, and other breathing disorders. Lung cancer is the #1 cause of cancer death in the United States, yet it is one of the easiest cancers to prevent because most cases are actually caused by smoking. And Kentucky does not have a statewide smoke-free air policy, so smoking regulations vary by municipality and jurisdictions, with many local governments having to adopt their own ordinance. Next slide. So the next phase of our citizen science project was engagement. Next slide. As part of this project, we recruited local community members and trained them along the coalition members to become what we call our citizen scientist. We also identified our local policy champion at this time. So this project actually, it empowers local residents. It gives residents the tools to actively participate in public health initiatives rather than just relying solely on external experts. Our citizen scientists were trained to conduct policymaker assessments and collect data. So our policymaker assessments usually begin early in the policy process and explores the potential effects of different policy proposals. Getting a better understanding of how key decision makers feel about smoke-free environments and laws helped us to predict the potential impacts of the proposed policy and inform our decision makers. Engagement was important and ongoing throughout this process and is still to this day for our coalition. Next slide, please. So the use of the citizen science project in tobacco control offers several advantages. It provides concrete evidence, real world data from local sites, and is often more impactful and credible to policymakers than general statistics. It builds community support. The process of gathering data helps build community awareness and support for these policy goals. So now that we are talking more about data, I really want to turn it over to our policy champion that we identified, who is our former Williamstown Mayor, Rick Skinner, to talk about how we use data to get to our smoke-free air ordinance. Next slide.
Thank you, Jamie. Marsha, I appreciate everything you're doing for us. And then before we continue with the slides, I just want to say that, give you a little background about Williamstown and my tenure as mayor. In November 2010, Answers in Genesis announced its plan to build a full-size ARC on 800 acres it had purchased in Williamstown. I remember that at that press conference, how excited I was for this and how anxious it made me. I knew that Williamstown was going to be transformed from a bedroom community to a tourist attracting people from all 50 states and many different countries. As Answers and Genesis worked on financing, the city started working on updating our parks and promoting healthy lifestyles. I worked closely with Flag to get grants for new playgrounds, equipment, and new sidewalks. We also knew that policy change was also important. We were one of the first counties in Kentucky to have a complete streets program. After these successes in the Ark Encounter opening, which attracts about 1 million visitors to Williamstown a year, we knew that we needed to address smoking at a much more vibrant way. And that way was through assessments. So we started this with the University of Kentucky, and they provided us with the measuring device called an air beam that we took to different places around Williamstown, because we knew the importance of the data that we were going to collect to convince somebody to become a smoke-free environment in Williamstown. Because you got to understand from the data that Marsha just gave you that 26%, that's 1 out of 4 adults smoke in Grant County, which is, I know for people around the United States, that sounds unbelievable. But for me, it's just a sad statistic that we got to overcome. So with this monitoring system, we had a baseline that we saw of what is considered air quality in indoor spaces. And we measured from that to determine at that time almost all of the restaurants in Williamstown had a smoke-free area and a smoking area. So we knew we had to get rid of that smoking area to make the restaurants and the businesses smoke-free. Next slide. So the results there show you how the 35 milligrams per meter cubed stacks up with clean air and how bad some of these restaurants were. So as we got our citizens out there, I was able to do a couple of restaurants. We had the data there to show just how important it was, for Williamstown to, I guess, get into the right mode for protecting our youth that work there, for protecting those secondhand smoke people that are in the restaurants, and to show the community the importance of not smoking in public places. The next slide. So advocacy is the act of actively supporting, promoting, or arguing for a cause, policy, or idea, often by raising public awareness, influencing decision makers, or rallying support to create positive changes. We knew we had to make the positive changes, but we also knew we had to have the data behind that. Next slide. So the Citizen Science Project prepared us for data-driven advocacy. The collected data showed that indoor air quality in smoking establishments was twice as poor as the outdoor air quality. Advocates used these objective real-time findings to educate community leaders and the city council members about the health benefits of smoke-free policy. Next slide. The Williamstown City Council did agree that everyone in Williamstown deserved the right to breathe smoke-free air and passed an ordinance in September 2018. And on January 1st, 2019, the city of Williamstown started implementing their smoke-free air policies. And we had a lot of public hearings before we went to that. And we were met with a lot of people that said, I have a right to smoke wherever I want to. But by proving the danger of smoking to other people, we finally got them turned around, we think, enough that they understood where we were coming from. Williamstown, Grant County is small. The opportunities for our youth to work were limited. So that they would say, well, they can, if they don't want to work here, they could work somewhere else. Well, there isn't that many places. So secondhand smoke for us was one of the biggest reasons that we decided to work on this policy. So next slide. The Citizen Science Project successfully led to a comprehensive smoke-free ordinance in Williamstown, making it a first jurisdiction in Northern Kentucky region with such a policy. The ordinance some of the city council members wanted to eliminate some things, but here's what it ended up being, and we were really proud of what we accomplished. No smoking in any indoor public places, no smoking within reasonable distance from doors, entries, windows, or ventilations units in the public places. We set that at 25 feet, and no smoking in public outdoor seating areas. That also included all our parks. So it was a comprehensive plan. We started from the beginning with comprehensive, knowing that we didn't want to just piecemeal something together, but an ordinance that would be good for the health of the community, make better business decisions, and for our tourism that we knew we were coming. So next slide. The Citizen Science Project aims to reduce youth substance abuse, exposure to secondhand smoke, and promote healthy lifestyles. This project helped us to advocate for Williamstown smoke-free air ordinance, and it started with assessment. We were able to engage local partners in the assessment, integrate assessment into the early stages of the coalition development, use the assessment process and data to inform coalition action planning, and select and implement coalition activities based on community concerns, focus on factors that contribute to community challenges. I'll let Marsha wrap this up. Thank you.
Yeah, so next slide. So you may be wondering, do the tools you just learned, you heard about from the Citizen Science Project apply to other initiatives? And the answer is clearly sounding yes. FLAG continues to use the tools we learned through the Citizen Science Project to advocate for policies that will initiate sustainable change. So we've worked with the Grant County and Williamstown school wellness teams to develop wellness policies for increased physical activity breaks, reducing sugary beverages, and increasing water availability, and our tobacco-free schools. We also continue to advocate for smoke-free environments. So we're proud not only of Williamstown's efforts to go smoke-free in 2018, but we use these tools. And then in 2023, the city of Corinth, our most rural city in Grant County, adopted a comprehensive smoke-free air ordinance. So we've been able to use these tools and apply this Citizen Science Project and assessment to other cities within Grant County. And as Rick had mentioned, we advocated for complete street policies, which ensures that all modes of transportation, such as walking and biking, are included in all development and road projects. And as he had mentioned, we're proud to say that Grant County was the first county in Kentucky to adopt a complete streets policy. So, like I said at the beginning, we conduct a community health and wellness assessment, and we do this about every 2 to 5 years to help us prioritize health issues and needs. And we're actually in the process of planning for that and rolling it out in the spring. So we'll be rolling out our next community health and wellness assessment in the spring to again guide us in our prioritization and just knowing what the community needs and what we need to do to address that. Next slide. So really, Rick and I want to thank you for allowing us to share the work of FLAG and the city of Williamstown with you. We encourage you to get involved in your community and make assessment a priority to guide your decisions. And if you need more or want more information about FLAG, you can go to our Facebook page or our website, or you can feel free to email me or Rick. If you email me, I can get the information to Rick, or however that is. But yeah, we are always willing to talk about FLAG and our successes and how important assessment really is to driving this coalition.
Thank you, Marsha and Rick, so much. What an incredible and inspiring story. And it just, I often say there's no better people than coalition people, and that just continues to be the truth. So thank you all so much with the information they provided, and then everything Katie was talking about in terms of our knowledge, skills, and abilities. Like, what do we do with all this information? How do we move forward? The first thing I want to remind people of is that it's not your job to know and do everything. If you heard what Marsha and Rick were talking about, they were talking about partners. They were talking bringing people together. That's what, when you're looking at these KSAs and you're thinking, I can't be all these people, you're not supposed to be. So how can we look at them and say, who do we need to bring to the table? So to go ahead and review what Katie was talking about and look through for assessment, the knowledge, skills, and abilities, and say, what can we do better at? Like, go back at your next coalition meeting, your next stakeholder meeting, and say, how are we doing on assessment? Where do we have some gaps? And then ask yourself, who do I need to recruit? When I first started in coalition work, we didn't have the money for an evaluator to help with an assessment. It really was a community project. And then we brought in, as a volunteer, someone from the University of Tennessee Space Institute who was retired and wanted to help out. And even as we were lucky enough to get more funding and get bigger and have an evaluation team, we were still able to use Max all the time, and he would help with different projects. So just be thoughtful about the knowledge you have in your community and who you can bring in to really help with some of these assessments and those knowledge, skills, and abilities. As both Katie and Marsha and Rick brought up, it's really important to take a minute, if you've been doing this for a while, to say, is this process working and how can we make it better? And if you're newer to it, how can we put the very best process in place for data collection? And I love when we're talking about things like SMART objectives, how can we get better at that and thinking really thoughtfully about the type of data we're collecting and prioritizing that, and coming up with a timeline, like Marsha said beautifully, like I think 3 to 5 years, like thinking about really trying to incorporate into our structure when this happens. So we're really building that institutional knowledge we want to see. And then finally, plan for others to be part of this data collection. As I mentioned, it's not all just on you. How can we get other people to help with this data collection, whether it's quantitative or qualitative, whether it's doing a focus group and talking to students or going out to businesses and getting some information? But also be thoughtful about how we can disseminate this. I think a lot of us have gotten good about having a community assessment because maybe we need it for a funder. That doesn't necessarily mean we've been really good about telling other people the information in that assessment, and figuring out how we can be better at, especially if you're a more advanced coalition. You might be really good with assessment because you have to have it, but are you good at communicating the data you're finding, the gaps you're seeing, and how can you communicate that information to different audiences? So you might be really good at making sure everyone knows about your student survey, but what about the other archival data we're seeing? Or what about just what came out from the focus group? How can we be better about communicating that so people want to come and be part of our coalition and part of some of these building up of the knowledge, skills, and abilities? So I just challenge you, as you go back leaving this webinar today, to be really thoughtful about looking at those assessment, knowledge, skills, and abilities and saying, where can we be better? And who can we bring to the table to be better with it? And then think through that process timeline and of course, dissemination. So you guys have this, like I said, no better people than coalition people, but just some next steps to challenge you with as you move on after this webinar.
You might be wondering, how can I increase my coalition's knowledge, skills, and abilities in assessment? Next slide. Well, here at CADCA, we focus on this crucial competency during our National Leadership Forum, our Mid-Year Training Institute, through various customized training services, but also through our National Coalition Academy. Next slide. In fact, as you can see on this slide, assessment is covered in depth during week 1 of the NCA, and then throughout the NCA as we go as well. Next slide. While we are moving into our Q&A portion, I'm going to go ahead and put the evaluation survey in the chat, and then I'm going to ask Katie to go ahead and put up the QR code on the screen, so you can either use this link in the chat or scan the QR code. We kindly ask that you take a moment to complete the evaluation. Please note, letters of attendance are given only upon completion of the evaluation survey. So let's go ahead and move into the Q&A portion, and please remember to put questions in the Q&A box. The first question I have is what did you collect, how did you collect the data in person or at events?
Yeah, so good question. So we actually we had it as a two-prong kind of approach. So we had it as a Survey Monkey link that we advertised in the newspaper, we had on Facebook, we had our partners put it out, send it out to their listservs. But then we actually had, hard copy paper and clipboards, and we would go to the events that seen a lot of people. So in our county, our our county fair is a huge place where there's a lot of people that attend. So we were there with our clipboard and we were getting people to take the survey and our assessment that way. We went to our Halloween in the park. And so anywhere there were going to be people, we were there. We had our coalition members there and we had them taking the survey and doing this assessment. So I feel like that's how we were able to get 425 respondents, and which I feel like was a good sampling of our population.
Thank you, Marsha. Next question is, what is the best way to gather data at community events where individuals may be hesitant to sharing their opinions?
Well, so also I failed to mention is that we had a pretty nice incentive for folks to complete the survey. We felt like this was important enough that we wanted to put a little bit of money to it. So we had $200 gift card that if they completed the survey, they would be in a drawing for. Getting people to take the survey, I think the incentive one was one thing. But I think our coalition also is becoming familiar to folks in Grant County. So we weren't seen as just another organization out there. So maybe that helped some. And I honestly think just being able to be a face out there that they could ask questions to helped with that. Rick, do you?
Yeah, I think the coalition members were leaders within the community that knew a lot of the community. So I think that was important because they were actually handing the clipboard with the survey to those people. So those people identified with the leaders that were asking the questions. It was important that we made contact with as many varied groups as we could, and we did that through local people going to local events, to the Kiwanis clubs, to the women's clubs, or to the different clubs, and asking, for them to also fill out the survey. And FLAG is a very strong coalition. It was the Chamber of Commerce awarded it 2 different times as the nonprofit of the year, and they only give that out at certain times. So we were extremely proud and extremely well known within the communities.
Thank you. While we're waiting for more questions to come in, I'll go ahead and ask one of my own. Christina, you mentioned looking at your stakeholders and recruiting members to help you. So who should I be looking for to add to my coalition when it comes specifically to assessment? And then what would be the best way to go about recruiting those key stakeholders?
Great question. So I think for coalitions, and listen, I'm not against the 12 sectors, they're amazing. But what I say is that the 12 sectors are a starting line, not a finish line. And we have to be much more intentional about looking at what we need for what we're doing at this time and recruiting on that. So for instance, we're talking about assessment. Who are the best people to pull into that? Who have done evaluations in your community before? Who have been involved? It might even be like on market surveys. I think we get stuck thinking about college institutions or maybe someone from a hospital who's used to doing surveys, which are great. If you have people with a medical background, a lot of the hospitals have survey people on staff. Of course, school systems do as well that can help with data assessment, or people that are attached to where data comes in, like law enforcement, or again, hospital, medical spaces. But also you can think outside the box. There's a lot of people in the business sector doing market surveys. things like that. So be thoughtful about sitting down and say, what do we need right now as you're going through it, whether it's looking at surveying youth or looking at surveying what pharmacists and doctors are doing, and then say, okay, who do we need to reach them and help us develop this survey? And then also, not just about the survey, like Abby was saying, but getting people to take it or getting people involved in the evaluation. So how can we engage them in that work? So who is the most influential that can be attached, making sure you take a survey, or making sure people within the medical professionals take a survey. When we were working on prescription drugs in our community, and this was way before the opioid crisis and everything we're looking at, it was really new at the time. The reason we found out we had an issue was because we were talking to schools about their data around alcohol, tobacco, and we wanted them to pull suspensions and expulsion drug sharing in school. And so that allowed us to start asking more questions. The first thing we wanted to go to at the time were doctors and pharmacists, and figure out how we could recruit them and bring them to the table to give us more information around what we were seeing with prescription drugs. And so it took us really finding a pharmacist to be a champion, going and saying, hey, we're seeing this, can you help out? Finding a hospital to be a champion to then help us conduct focus groups. And so think about it in two ways, both what do we need in terms of data collection, but also what do we need in terms of people who are going to be either taking our survey or going to be part of our focus group, and who has the most influence to outreach to them, to bring them to the table to actually give us that data on top of it. So I think you need to look at both of those. And like I said, just be thoughtful about what you really need. I think we struggle with all calls with Coalition. Like, I'm just going to put it out in an email and hopefully it will hit. I want you to be really strategic and intentional about exactly what we need and who we're going after, so that we're more likely to have that partner come to the table.
Thank you, Christina. We use both. The next question is, we use both digital and paper surveys, even offering incentives. This year, it's a big smart TV. They usually start promoting at least a month in advance, but the response rate is still so low, and they're just wondering what they're doing wrong or would be doing wrong.
So I don't know that you're doing anything wrong. Honestly, I think it's, I feel like since COVID, there's been a lot of, and I hate to use COVID, but I really do feel like there's been some kind of disconnect and then we're also in an age right now where you're getting QR codes and surveys for everything. I mean, you go to the grocery store, you have Kroger delivery or your, grocery delivery, and you get a survey. They want to survey that. So I feel like we're also in a time where surveying is like, there's just so much of it. So I don't know that you're necessarily doing anything wrong. I would suggest the one thing that we do is we open up our assessment period for at least 3 to 4 months. So this gives us time to actually go out into these community events and do like meeting with the people and trying to reach some target populations. So, and the smart TV is a great idea for an incentive.
Thank you, Marsha. If you don't have an evaluator, how can you decide what questions to ask and how to ask them? What methods do you use?
So we use existing surveys, like we look at the BRFS, we use the Robert Wood Johnson's county health rankings as a guide for us. So we try to tailor our questions so that we can compare our results to what is being reported in the Robert Wood Johnson Foundation. And then we have Interact for Health, which is a local foundation that does a lot of data collection. And so we try to make sure it's apples for apples, right? We're using similar questions so that we can compare the data to existing data sources.
Do your questions and data points change every time you do an assessment, or are you updating previous assessments with the same questions?
So we've really, I know this was mentioned before, like using your assessment to look back at maybe what was different in previous years. So our assessment, we try to keep it similar. We may, depending on what, like we added substance use in when we were seeing a high spike in overdose deaths. So we decided that that was important for us. So the last assessment cycle that we did, we included questions like that. So it's not necessarily that we're changing questions, but we may add questions depending on what the climate is at the time.
Thank you. Next question is, does CADCA have any guidance about how to properly frame survey questions to avoid leading questions or minimize confirmation bias? And so for this, I would say we do have at CADCA an evaluation and research department. And so I'll ask Kellen to drop the email in for that department into the chat. And if you have questions like this, please feel free to email them and they will point you in the right direction. Next question is, what are some actions you could suggest for advocacy between coalition members and local policymakers?
I'm happy to jump in here too. I mean, this is what the assessment's really all about, and getting that information out so you can use it. The whole point is action at the end of the day. So making sure your coalition members are trained up, understand the data, and then having them make appointments, having them invite policymakers to legislative breakfast, showing up. This is what I say all the time. Policy change takes time, as you know, from hearing this. So showing up at all the commission or council meetings, making sure you're being seen and providing this information. What I always say is policymakers are not experts in everything. You are the experts in prevention. So they need you to be giving them this information and talking about it. So becoming a trusted source for that information by using your assessment of the data is going to be really important. And I think, I'm sorry, Marsha, if I cut you off, because I think I saw you jump in.
I certainly agree with what you're saying. It makes such good sense, and that's what we did each time. Is we made sure members of our coalition went one-on-one with each of the city council members to answer the questions, provide our results, and to bring back to the whole coalition if there was pushback, what it was and how we would address it. So yeah, that one-on-one with the council members, and then being active in the local clubs, organizations, and attending the city council meetings just to be there was very important, I think.
Thank you, Christina and Rick. Okay, this will be our last question. We do have quite a few more questions after this one. So what I'll do is in the post email, I will have answers to these questions that we will ask our presenters to provide written answers to, and that'll go out to everyone who attended today. But last question for today, did you share your assessment findings back with the community? And if so, how?
Yes. And so I know Christina talked about how important it is to share those results out. So we absolutely shared our results. We put our outcome report on our website, out on Facebook, but we also took that a step further. We went to our Chamber of Commerce does a monthly breakfast. So we went there, we presented the results there. We went before city councils within each of our cities in Grant County and presented the results. And then we also, each coalition member had the results. So when they were out within, like Rick was talking about, Kiwanis and their prospective organizations that they are participating in, they could share the results out as well.
Thank you, Marsha. As we conclude today's webinar, I just want to give a big thanks to our presenters again for sharing your work and insight, and we want to thank all the webinar attendees for your participation. I went ahead and dropped the link to the evaluation survey into the chat again in case you haven't had a chance to click on it or fill it out. Next slide. Our next webinar will be on October 15th at 1 p.m. Eastern Standard Time, and will focus on readiness. The registration link is in the chat. Also mark your calendars for the community engagement competency webinar, which will be on November 5th at 2 p.m. Eastern Standard Time. We'll send out a registration email closer to the webinar date. Next slide. If you have any questions about today's session or where you can find assessment at CADCA, please feel free to contact me at anellis@cadca.org. Thank you again for joining us, and we hope you have a wonderful rest of your day.